Pharmacologic management of anxiety in perimenopause. The standard treatment for anxiety in perimenopause remains an SSRI or SNRI with or without psychotherapy. Just as for depression in perimenopause, cognitive behavioral therapy and other evidence-based therapies are used to treat anxiety that arises during perimenopause. Like other times in a woman's life, you want to use prior response to guide treatment choice. So if someone has had a positive effect to an antidepressant, you would consider using that again. Menopausal hormone therapy has a beneficial effect on anxiety, but one study suggested that improvement in anxiety with menopausal hormone therapy was only seen in women with co-occurring hot flashes. This is a very helpful flowchart to decide how to treat anxiety that arises during perimenopause. So the first question to ask yourself is, are anxiety symptoms associated with other menopausal symptoms? If they are, you want to know, are there any contraindications towards hormone replacement therapy or menopausal hormone therapy? If there aren't, you could consider a hormone replacement therapy trial. That would typically include transdermal estradiol and oral micronized progesterone. We use oral micronized progesterone because it is metabolized into allopregnanolone versus a synthetic progesterone, which is not metabolized to allopregnanolone. If the anxiety symptoms are improved on the hormone replacement therapy trial, you would consider hormone replacement therapy. Let's go back to the beginning. So again, are anxiety symptoms associated with other menopausal symptoms? If they aren't, then it's really important to assess the differential diagnosis. We know that there are very many different mental health disorders that can cause anxiety in perimenopause. You would want to look at generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, or other diagnoses. With panic disorder, there is significant overlap between panic attacks and hot flashes. Depending on what the differential diagnosis tells you, you would want to treat the primary disorder if there is one. If there's no clear differential diagnosis, you would want to consult a mental health specialist and consider SSRI or SNRI or cognitive behavioral therapy. Key points. You want to use prior treatment to guide a medication choice for perimenopausal anxiety. SSRIs and SNRIs are both first line. Menopausal hormone therapy has been shown to improve perimenopausal anxiety, but one study showed that anxiety only improved in women who had co-occurring hot flashes. Why this is important is because there is much overlap between anxiety, panic attacks, and hot flashes. So it's possible that menopausal hormone therapy really only treats the vasomotor symptoms and might not have a direct effect on perimenopausal anxiety.